Now we take up the second part of it, that is quality of education that depends on health. Now the proper health care helps a person to realize his potential and the ability to fight illness. And in health we have two measures, that is preventive measures and curative measures. Now when preventive measures are those measures which are adopted to prevent people from falling sick. For instance, we have this polio drops that are given to the babies for protecting them against polio. Likewise, we have smallpox and so many other vaccines. These are all preventive measures, and the cleanliness and the hygiene and all these are all a part of the preventive measures. On the other hand, we have curative measures, which means that the measures that are adopted after a person or people fall sick. That means that it can be by means of medicine, it can be by means of injection, it can also sometimes be by means of surgery that may be performed according to the situation and the condition of the patient. Now, the government's national policy, there are certain aims that are there. That is number one, to improve the access and provide healthcare facilities to people not only in the urban areas but also in the rural areas and in the villages as well. Then we have primary health centers also over there. We have dispensaries and right. Then the family welfare is equally important. Family welfare would mean that the health of all, not only the male members but every single member of the family, of how they can be better nourishment for them, how they can be able to have a better state of health so that they can work well. Then nutritional services, the special focus is on the underprivileged section of population, because they are poor, and being poor they are not able to provide enough food, a balanced meal for the children and the families also. So these are the aims. Then what is the outcome of this policy? One can say that it has tremendously improved the life expectancy. That means the average age now is about 68.56 years as such, which used to be earlier on much lesser than that. So that means that the people's health has improved, and therefore on account of that also it has enabled them to enjoy life and do work well as well. Then we have the next is IMR, that is the infant mortality rate. That is, the infant mortality rate has reduced. Why? If the mother is looked after well, the infants are born healthy, and if both of them are looked after, obviously it is going to lead to a longer life. So the infant mortality rate, in other words, that means the death has been reduced among the infants.